Okay.
Okay.
No, you are the presenter, aren't you?
we were having age before beauty.
Okay. We are live.
We were talking before we went on air about how this pandemic affected a lot of people, everybody, but mostly people who didn't have the means to stay home and survive. However, it's my experience in countries like Mexico, probably in other Latin American countries happened too, that we were able to create a network with the priest at the church in my hometown. So he and other people would go around town, and we advise, to let as many as possible people know that if they needed anything, they should put a red handkerchief on their window, so they can go and buy, food stuff or medicines, or just sit outside across from the window and have a chat, whatever. Because
okay, so we are live now. I think it's time to start.
Okay.
All right. So thank you everyone to the 27th edition of ICANGOVERN Insights. ICANGOVERN Insights, or Indian Citizens Alliance for New Governance, is a governance initiative where we try to sort of focus on solution-centric deliberations and grounded actions. So today I have this immense privilege to host a formidable, multinational and forward-looking panel with almost 100 years of combined experience, I believe, from all walks of life: senior journalist Miguel Molina to Nagesh, who is a finance professional working in the education sector, and of course, people from health professionals, Aastha, Bryana. We'll have also Akanksha joining us, and Dr. Mohit as well. So thank you all for joining us today. This is, I think, I must say that this is an absolute delight for us today to have you all on this panel to deliberate over what happens to be the biggest challenge of our time. So I think when we were thinking of teasers for today's deliberation, for the first time, you all gave us the reason to say that today we have guests from maybe Darbhanga in Bihar to Delaware in the US. So thank you so much for joining us today. And we look forward to having an insightful and solution-centric sharing of our individual, global, and local experiences about staying healthy and dealing with COVID-19. So first of all, I would like to welcome senior journalist, former radio producer, and presenter for the BBC World Service for Latin America, and senior trainer at the BBC International College of Journalism, Miguel Molina. Mr. Molina is from Mexico and is currently based out of Geneva, Switzerland. He has worked all across the world, telling stories, training young journalists like me, and infusing the kind of energy and enthusiasm that gets the best out of you. So welcome, Mr. Molina. Yeah.
Thank you very much.
We have Dr. Mohit Bhatia and Dr. Aastha Matto, both of whom have worked with major government and private hospitals in India and are currently fellows with the National Health Service UK, based out of King's College and Trust, London. The doctor couple are full of ideas and passion to make humanity healthier and happier. I had the opportunity to engage with them a couple of weeks ago for a 1.5-hour long discussion over multiple challenges related to health sector, and hopefully we'll take that forward today. Thank you, Mohit and Aastha, for joining.
It's a privilege. Thank you.
Thank you so much.
Also managed to wake up Bryana from the US, from Seattle. It's 5:30 a.m. there on a weekend. Thank you, Bryana, for agreeing to spoil your long weekend morning. Bryana has a cultural anthropology background and has just joined a clinical stage biopharmaceutical company focused initially on treatment of cancer, and she has joined as instructional designer. She was earlier for 6 years as a health education specialist at Seattle Cancer Alliance. So Bryana has also international exposures. She has worked she has studied in China, worked in the US, and I believe in several other parts of the world. And we could not have done without a year on the ground. So joining us very soon will be from Darbhanga, Bihar, Akanksha Kumari. Akanksha has previously worked with the prestigious Leelavati Hospital in Mumbai and is currently posted as a community health officer at the dedicated COVID healthcare center in Rampatti, Madhbubani, Bihar as a counselor. Last but not the least, we have Nagesh Kumar from Delaware, US. Originally from Rewari in Haryana, near Delhi, NCR. Nagesh is a graduate, economics graduate from the reputed Indian Institute of Technology, Kanpur. He is currently Director, Student Loan Strategic Growth Analytics at Sallie, Wilmington, DE. So once again, thank you, all of you, for joining today, and welcome once again. Now, I'll first of all like to have Mr. Molina to sort of share about it. But I think before you talk about your experience and all things, I was just wondering that there is this famous French philosopher, or call it psychologist, Emile Coué, and he had given this this treatment method in which he would, even very serious patients, he would just do this treatment that to repeat telling that, well, I feel healthy and energetic. That was his therapy. He would request his patients to consistently tell themselves that I feel healthy and energetic every day, day by day. And over a period of time, many of them would recover even from serious disease. Now, somehow, the kind of things that get into our mind, that has a huge importance. You are from media field. You have worked all across the world with BBC, one of the world's most formidable, reputed channels. How media and the rhetoric, I would like your opinion on that as well, and of course, your experiences as well. Miguel.
Well, I think media has played a very important role, both for and against the right things in this pandemic. For, because it's been a source of information, it's been a tool that we can use in order to be aware of what's happening, of what can happen, and more important, what are scientists saying about this. On the other hand, media has also been a tool for misinformation that has harmed a lot, caused a lot of harm, throughout the whole pandemic. When you mentioned about this treatment, when people say, I feel better and they get better, I promise I've tried. I say I feel young, and it doesn't work that well for me. So I say I feel young, and I'm not. But at the same time, media is looking not so much after informing, but after clicks that cost revenue. Not all the media, but that's one of a shameful thing that media has been part of. I think if we had started right from the first moment, a lot of pain and hurt could have been avoided. It was not the case.
All right.
Yeah.
Well, I think also, would you like to say something about, I think when we were talking, you said your mother is so old, almost in the late 80s.
Yeah.
Is her world very different compared to your or other upcoming generations?
Well, luckily, my mom, we are a lot of brothers and sisters, so we can, outnumber her and force her to stay home and look after herself. She's one of the lucky few who don't need to go out. You see, but a lot of people, even more so in Latin America, they need to go out to earn the daily living. Ditto in India. I mean, you don't have the luxury to stay home and say, okay, I'm gonna wait here until the whole thing ends.
All right, so thank you. So I think we'll keep coming back to this question maybe. And I'm sure that there will be queries related to this as well. I would like to bring Dr. Mohit here, and you're doing a fellowship related to clinical subjects, clinical research at one of the world's most reputed, you and Aastha both one of the world's most reputed health services research centers as well. I think there are aspects, of course, that you would like to say that, well, how possibly a developed world health system there are things to learn, at least for the developing world, or maybe I think both ways. There are things possibly the developed world can also learn from the developing world. But apart from that, I think this question that, well, there are things that need to be analyzed and there are things that possibly need to be synthesized. So this dynamics, how do you think we are going ahead? Are we actually analyzing and going towards synthesis, or we are somehow getting confused? Dr. Mohit, you're on mute. Please unmute yourself. Yeah.
So I was saying, I think so. This would be definitely reflected back upon, once things would settle down. The setups, even if it is developed world or a developing country, they would reflect into it, and I'm sure they would learn from each other. With this, what has happened recently, this at least is very much evident that irrespective of how much infrastructure you have, when something of this magnitude strikes, it has its own devastations on either systems. We have seen a country like India, which has a big potential, but they don't put a lot of infrastructure into their setups. They were kind of okayish during the first wave, and probably they thought that they would sneak out of the door during the second one as well, but that did not happen. And I would say for UK, during the first wave, they were facing a lot of challenges, but I must salute their system, because when the second wave came, they were fully prepared in terms of they knew where the weaknesses were and they knew the limitations, and I think so they managed pretty well. And now coming to the fact, I think so with as I said, with time you would realize that things would change in on daily life basis as well. When things get back to normal, maybe 2 years down the line, you would see the health setup or their functioning might change to kind of make everyone ready for if there is any further epidemic or anything which happens in future, they would be more ready to be aware of. And now the epidemiology and the subjects which were not given much of, I would say, importance or their due in the past, they should be consulted more to have the kind of awareness for everyone to face all this. So I would say that everyone should learn from this pandemic in a positive way, and be any country, and I'm sure the developing countries should take something out of the developed world, because I can give 50 examples of what we did right and what the other countries did right, but that is not the main motive. The main crux is that I think so everyone should actually form a sort of a committee to reflect upon what happened and how we could have, or we can, in future make things in a right way.
Dr. Aastha, I think I would like to bring in here to sort of talk about the fact that, well, I think we have, at least the developed countries for sure, were prepared for the second wave. But the fact is the first wave itself did its job so substantially in terms of number of casualties, in terms of, and for that matter, we do not know if there is a next serious disease. Will we be prepared? Do we have the mechanism for such eventualities? That, well, in the first wave itself, I think we should be prepared then. How to do that?
I think for the first wave, it was a general phenomena for all the countries over the globe, which faced the challenges, and everybody faced the challenges. As Dr. Mohit said, I totally agree with him that India was quite lucky to escape the first wave very easily. But unfortunately, when the second wave came, I don't know why, but India was not quite well prepared with it. And what I feel is that if I compare it with UK, at least, if I compare it with the UK, UK has been really well prepared with the second wave. The first wave did not go very well over here, but the second wave was very well managed, and I'm very sure that they are very, very well prepared if in case a third wave comes, because the cases have been rising over here as well. So if the third wave comes over here, they are very well prepared with it, with that as well. And for the future as well, I feel looking at the system so far, this country has a backup plan for everything. If they are doing something, they know that if it fails, we know what we need to do next. But if we talk about India, I think it's really important for them to learn from the mistakes other countries have done, and the mistakes they have been doing in the second wave. So I think it's really important. Otherwise, it is just it would be the same every time, every wave, and by far there has been no improvement in controlling this unfortunate disease. And I think if they don't manage it properly, it would be a disaster.
But the question possibly arises is that can we have a situation where most of the world, I think the developing world, the developed world, the third world, the underdeveloped countries, we have a real situation where possibly it's not feasible or to even imagine that we'll have a first world infrastructure in all countries all across the world at every point of time. So that is a real trap, isn't it?
Yeah, definitely it is. But I think even if we talk about the countries who do not have a proper infrastructure, for example, I think even if the basic is being done by the people of, like, the citizens of the country, I think even that would help. I think it is taken a lot for granted that it's okay, it doesn't matter, and it's okay, to move it that way. Half of the people even think that it's not even a disease, it is not something which is going to affect us. So unfortunately, that kind of mindset has to be changed firstly. And even if any country, for that matter, doesn't have a proper setup, I think at least the people the government needs to educate people. They need to know how important and how devastating the situation actually is. Because I feel government of every country is doing to their best possibilities, but I think people have to be involved as well, because it is not just one way; it is both ways. The people and the government both have to work hand in hand to actually bring something good out of it.
Okay, Bryana, you deal with cancer patients and cancer-related stuff, which was considered at one point in time fairly fatal in terms of number of casualties. Still is one of the most dangerous disease, and I think many types of cancer is totally incurable. As someone who continuously deal with such situation and possibly works in that field, where do you see where we are heading? Are we in the right direction? Bryana.
Are we heading in the right direction? I think having the vaccine definitely helps. I think getting it to these small towns and villages like in India is the hard part. In the U.S. we sent out the military. We sent everyone, all hands on deck, and we got exactly the number of vaccines that we needed, and we're moving toward a better place for sure. But yeah, I think the poorer places in the world are struggling because they may not get the vaccine this year. Maybe it's next year or the year after, I don't know. Just the timeline for these other places is a lot longer, unfortunately.
Well, I think so that sort of suggests that possibly the picture may be far more complicated, at least on the face of it. Well, I think here I would like to sort of bring in Akanksha, Dr. Akanksha, briefly. And Dr. Akanksha, you come from one of the smallest towns in India, which also happens to be one of the most backward in terms of all indicators of human development, including health. And you would corroborate it much better that because you have worked in some of the finest hospitals of India as well, Leelavati to name. So I think, yes, please, what do you think, Dr. Akanksha? Please unmute yourself. You are on mute. Yes.
Mm-hmm. Yeah, actually, here is the situation. The people think that corona is nothing. They feel. People are feel that corona is nothing. It's not a disease. It's a myth. That's why people are not understanding what the situation is going on. And they are not cooperating us. When the patient came to the hospital, they will not tell you that I am suffering from the positivity or the symptoms are coming, what the symptoms are. People think that it's a normal symptoms of cough, cold. And when they are coming, they are not accepting these things that we are suffering corona. And the attendant, mainly the attendant, are not. They feel. Actually, they feel that we are just pushing them in other directions. They are not even ready for taking the vaccines here. And dealing with the patient attendants, we feel so hard that even if you are trying to accept or if you are trying to adjust with it, we can deal with you. If you are not trying or if you will not listen, we can't do anything. The main thing is that there is the main problem that people are not understanding here also. From the small town, they are not wearing masks. They will not allow to take medicines. They will not take you as a medical profession, beat you also. If you are trying to motivate them, they will beat you. And that's the main thing that we feel or we get very harsh support from the society or the community. That's the main problem here in the small town.
Well, I think that brings us back to the first question that Miguel was talking about. I think so. If you do not provide information, then of course people become bad.
We as media have been very keen in publishing whatever we have at hand, and that's not necessarily good. I can feel both in Latin America and in Europe and probably in any other country that there is this idea, as Dr. Akanksha was saying, that how could I put it? It is something shameful. We need to be embarrassed if we get sick. That's not the point. But the media have been guilty of publishing all this stuff. Many people have the idea of freedom. Oh, now we are free. We're going to take our masks off. This is not freedom. It's about safety. It's about safety. Right now in Europe, you can see many people getting ready to go abroad for holidays because, oh, we need to go out on holidays. No, the virus has no legs. If we don't go anywhere, the virus goes anywhere, nowhere. But if you go, the more people moving around, the more chances of spreading around the virus, any of the variants, any of the things. Then there's the other part. Oh, the vaccines. Oh, I don't believe in vaccines. Many people say influenced by the media. This is not a matter of belief. Yeah, you can say, I don't believe that after the night comes a day. But that doesn't change things. I mean, many people don't have tuberculosis, measles, and polio, and a number of other diseases because they were vaccinated. Nobody asks us or asked us whether we believed in the vaccines or not. They worked. So, vaccination, that's it. Then the other thing is, we as media have failed to make people conscious of the importance of staying where we are. Do we have to repeat vaccines? Yes, we do. At least two doses of every vaccine. Or there are some vaccines that don't need 2 doses, but we need to be vaccinated so we don't get sick, or if we get sick, it's just very mild. But then we ourselves serve as witnesses that it works. Science works. Otherwise, there's no hope.
Okay. Yeah, I think that's definitely true for sure. That on the one hand, we have a need for vaccination. On the other hand, we have a panic kind of situation where people have all sorts of fears. Dr. Mohit, I think there was a question right now from Gunjan Bhatia Bhugra, I think, on the screen. Do we have to repeat vaccines? What would you say about it?
So when we say about repeating the vaccines, the thing is that right now we have been thrown away with so many different kind of vaccines which have different effects and different protocols, and I'm pretty sure that in few months time we'll have a vaccine which I think has already been announced by Johnson & Johnson, that there would be a vaccine which is only one single shot, so you don't even have to repeat any further vaccines. And then when you see people, there was a recent article which stated that around 20 to 25% of people who already have had 2 doses of vaccine, which is considered as the optimum treatment, are still infected with COVID again. So in that case, you may find that after a few weeks, months, a study might come and that would propose that even if you have done with vaccines two shots, but if you get infected, you may have to have a booster as well. But it is all dependent on how well your immunity works and how often, rather how quickly we actually get out of this, because we have seen in the past that there would be a big uprise in any kind of infection, and then it would form a plateau phase. And I think so once we form the plateau phase, we would not be bothering much about having to repeat the vaccines again.
Thank you. I hope that answers the query from Gunjan. I think there are several emotional issues also, of course, which Corona brought in for all of us, our parents, maybe family, maybe friends, close ones, at times ourselves. And Nagesh, you deal with the student loans. And I think we have had all sorts of cases where those who were not able to pay fees, they needed support. And at the same time, of course, as a corporate, in the corporate sector, you have to work for survival, for companies' profit as well. There's a lot of complex challenges. And I also believe that you live in the US, your parents live in here in Delaware, Haryana. So that's another sort of emotional challenges. How you deal with all these issues which keep coming on, along with the pressure of the corporate job?
Well, I guess you just have to maintain a positive attitude, I suppose. Keep talking to friends, family. I guess that is, what got me through, and my family through this. Having, I guess, video conferencing, technology, that definitely helps a lot, I suppose. So yeah, I guess constant communication is the key. And then I guess going out and about, but safely. That's, I guess, also, I guess, one of the strategies we with it out here in the US. I guess everybody's lucky that we have national parks, we have, I guess, state parks. So that sort of stuff, going out in the nature, that is definitely, a good thing. And I guess keeping yourself informed. So that's, I suppose, also one of the things that you can do. But I guess not being paranoid, I suppose, because as we've been saying, multiple times, there is like a multitude of information, right? So in fact, I guess too much information, if I can say that. So just I guess identify the sources that you can trust, and then only keep following them. So I guess that's another crucial thing to get through something like this.
Thank you, Nagesh. Miguel, you want to say something? You're on mute.
Oh, okay. Well, no, I agree completely with what Nagesh just said. I mean, it's a matter of being informed, well informed, not misinformed. And to be cautious, not to the point of paranoia, but to be cautious. I being, more or less inside my house, just going out for grocery shopping and back. We don't go out at nights or to have a drink or a dinner at restaurants, whatever. For over a year, I've got 2 shots. My wife got 2 shots as well. So we should be okay. Still, we are not trusting yet because we don't know. So holidays, millions in Europe are thinking of going on holiday. Millions of people in Latin America are thinking of going on holiday. Freedom, they say, it's not freedom, it's risk, it's taking chances. Yeah, we shouldn't be paranoid, but we should be careful. I mean, I wouldn't go to a concert where there would be 5,000 people, even if everybody got a mask and everybody has been vaccinated. Why should I try? Why should I risk it? Until this thing is completely gone, and it won't be completely gone ever, but more or less gone, we shouldn't risk it. Not only because of ourselves. In theory, I cannot get that sick, but I can still carry the virus. And somebody I meet, somebody I love, can catch it from me. So why risk it? To me, that's very important. So I agree. We shouldn't panic. We shouldn't be paranoid, but we should be careful. Oh yes.
Yeah.
Can I add something? Because Miguel has mentioned it very rightly, and he has said it twice. That people now have taken that there's a freedom to kind of do whatever you wish to. But let's when we talk about vaccinations, people now they have their own apprehensions. I think so. The main reason is the more you get educated, your questioning starts. That is fine, but then there has to be a point where you actually have to trust what has been told by the fraternity, whosoever is dealing with it. Let's take an example of India 20 years ago when we were struggling to get polio out. Nobody questioned the polio vaccination drive because people trusted the whole system that okay, if we have been told, that's true and it would work, and we have seen it work. But now with the access to internet and to all the misinformation which WhatsApp will provide you day in day out, even if I text one of my friends or relative like anything which is bizarre, that would spread to like thousands of people by tomorrow, and they would start believing it without knowing what exactly is the source or what is the authenticity.
Some substance possibly to doubt, such as people believe that, and people say at times as well, that well, there are some medicines which earlier were very, very popular and over the period they have been banned. So I think medical science seems to have a lag in terms of certifying medicines and saying correctly. I think this has, do you think that this is possibly one of the reasons why people have doubt about it? And what do we need to do about that?
No, I would say, yes, you are right. You can say that people might say that, this medication was initially considered and now they're saying, let's not do it. But especially in medical field, you have to back anything that you are saying with some kind of evidence. And if given, in a given point of time, you start doing a treatment which you believe is going to work, but, with time you get an alternative to it, which you feel is much better, then I think so there is no harm in kind of, blocking the first thing and going for the second one because you have a proof. And if we talk about COVID, there were multiple trials done by multiple countries. Everybody tried because it was a state of panic where everybody thought what would work, let's try that. And then with time you realize, that you have to kind of overweigh what are the benefits and what are the side effects of something. I would say if a drug is life-saving, you have to consider it as life-saving and kind of, just put down aside what are the side effects of it. Because what is the main aim? That is to, kind of save lives. But I mean, again, I would say that people, they have their own apprehensions, and they would think, that this was initially given, now they're saying don't give it, so let's not trust the medical fraternity. I, being from the fraternity, would say that is something unfair, because nobody's kind of treating people like guinea pigs. They're trying whatever they feel, what they have been reading in the books for years, which have been the protocols worldwide. This was something new, and I think so, if you compare it with last year, things are now, in terms of treatment, very much streamlined. The protocols have been made.
Okay, Akanksha, what do you think in terms of the perception people have of treatment methodologies and doubt? Is it more in small towns and villages? And if it is, why is it so? And what can be done about it?
There is a belief regarding medicine that medicine will not work, oxygen will work. Here in the small town, they believe that oxygen is everything. If the patient is cured after, like post-COVID patient is totally cured, now the medicines are worked, they are now discharged from the hospital, but they will not try to take discharge. They will have the tendency to be on oxygen for 21 to 22 days. After counseling also, they will not take discharge, and forcefully we can't push them to go home, because they are in our part. So if we are doing something like that, the wrong perception will go outside.
By the way, is there also
force them
a
to
generation gap sort of thing? I believe we had this conversation when you were telling that your grandfather he gets up early morning, he is far more stronger than your father maybe, and maybe you as well.
Actually, the lifestyle of the lifestyle of my grandfather or the old age peoples, they are following their traditional lifestyle, and we are not following right now. That's the main gap. They are very healthy. Their immune system, their working power is much good as us, because we are not now following the traditions. Actually, the work change, the lifestyle change, the food lifestyle change, the fooding pattern change. That's the main thing also.
That's an interesting angle. Yeah, I think that's a very point.
Telling them, actually, when we are telling them to follow this thing, they will tell us, no, I will follow the tradition, the old tradition. I will, good, I'm okay. Here the main enthusiasm is this, that the old people will not accept your nowadays lifestyle.
Okay, I would like to bring in Dr. Aastha here, in the sense that now you see we have a situation where not just old people believe themselves that they are stronger, but we have a health professional who also believes that her grandfather is possibly stronger than her father. Now, how do you convince them that, well, the medical science has moved ahead, and, well, I think you need to listen to this thing. How do you convince such?
Well, that's a very difficult task to do at hand, but what we can do is that I feel it is more important rather to convince them. I think it's more important to convey a set of information in a way they believe. As in, we as people, we as doctors, and I think here is somewhere the media comes into play. They need to represent the information in such way that, I think the most important thing is that people have to believe doctors. That is the most important thing. They have to believe that what we are doing is right. And the people are self-medicating. They don't believe. They think if as medical professionals, if we tell them that, this medication, for instance, let's take COVID in hand. If we tell them that you do not need medications for now, you're okay. Just be under isolation and you'll be fine. But they just do not want to take that advice. And what they do is, because there has been a very good availability of medications, and people do get medications without prescriptions as well. So they do take medications on their own. They develop resistance. And I think that is the most bizarre thing which I've seen, because people have to believe doctors. People have to believe what doctors say. And talking about our, an era of our grandparents, I think I had my I had my grandfather telling me these stories, that there was a very famous doctor in their hometown, and they used to believe them blindly. That is the kind of trust we need right now. That is the kind of people we need right now. If we tell them to do something, they have to do something. You cannot just you cannot just go out for shopping. Like, you cannot just visit one doctor, then second doctor, then third doctor, unless and until you reach to somebody who tells you what you want to hear. That is not how it works.
I think that's a valid point, but I think, Miguel, what do you think? Respect or this trust is something to be commanded or demanded?
Well, look, one of the main questions that appear on the poster of this conversation, promoting this conversation, is, can science save humanity? My answer to that is no. Only humanity can save humanity. Because as Aastha said, the doctor can say this, do that, but if people are not willing to follow the advice, it's useless. You can tell people, please, I'm going to use a very easy example. Do not go to Kumbh Mela. And then you have millions of people there. That then they moved around, they went back to their places, and it was a mess. Same thing is going to happen. I saw a question about the UK, that they say they are about to end lockdown on the 21st of June. It's a mistake. It's a mistake. Right now is when people must be most careful. So that if you think that going from the UK to Portugal and back is going to be safe, it isn't. You see, so it's not science, it's humankind. What we do ourselves to ourselves is what's going to save us. If we believe in science, it's because we believe in what science is doing. It's sad, but it is true. But people don't seem to be too keen to believe that they need to do something. It's everything is left to science or to the government. And in the case, Bryana could tell us more about it. When we are injected those microchips from Bill Gates so they can control our minds, and I mean, please. So the more informed we are, the more we listen to people who really know, not the overnight experts that pop up in the social networks, in Facebook, but the people who really know, who's really studied, virology or pandemics or whatever. Those are the ones who know. And if we listen to them, we can come through. Otherwise, they are going to just be, they will be just preaching in the desert, and nothing is going to happen. It's sad. I keep saying we as media are part of the problem.
Very, very crucial questions raised. Bryana, your comments. I think Miguel has pointed something out to you. Please.
Yeah, I totally agree with you, Miguel. And I think a big part of it also, from my perspective here in the U.S., is our past administration did a very poor job of, taking this seriously and, engaging the public with the, scientific information. So that really put us at a disadvantage, all through last year. We had doctors on one side, politicians on the other side, and a lot of people, took a side, and, it got very confusing for everyone, because there was a lot of misinformation spread by our previous administration, and on what basis. So, yeah, we've had to really, really pick up the pieces this year. And I'm so grateful for our new administration, you know, and we're an example to the rest of the world. And so I'm very relieved this year.
Yeah, I think we are all very, very relieved this year compared to previous year. I think that's a good sign. Nagesh, I think one question that comes to my mind is, you have lived in Rewari, which happens to be not very far from Delhi, but at the same time, very much what we can call to be a small town village kind of setting. And then you are in the US, which happens to be, of course, one of the world's most industrialized nations. So from this part of the world to that part of the world, you see there is a world of difference in every terms. And the question that we are discussing right now in terms of trust that senior people have. You talk to your parents, maybe you talk to your grandparents, your family friends. Do you see this gap?
Yes. Yes, absolutely.
Treatment methods, so many other queries, information, disinformation.
So, I'm sorry, Tilak, I think you did break up for a while there, but I think I got your question. So do let me know if I'm not answering the right question. But I think what you essentially want me to talk about is like what is the difference between like what's happening in India in terms of like beliefs of people maybe, and what it's like out here in the US. Did I get that right? Maybe.
Yeah. Primarily yes. That's the same question that you have traversed both the worlds. How do you see people responding to this current situation?
Sure. Yeah. So I definitely see a world of difference, you know, between people who I know back there and people who I know here. Some of it can, you know, also be, you know, like more a function of geography, maybe, sorry, education, maybe than geography. But thing is that out here, I see, you know, like when you give people advice, they take it and they follow it. But you know, back in India, when you know, tell people, you know, these things, you know, the right things, how things are supposed to be, and what's supposed to happen, they always have that, you know, questioning attitude, like why should we do this, you know, and you know, something that Dr. Akanksha was also talking about, like we are, I guess, undefeatable, or maybe like this thing cannot touch us. So I definitely see that, you know, difference in attitudes. In terms of like how we can maybe you know, deal with this, I suppose. So I'm thinking, you know, just have to, you know, preach, you know, the right things to the right people. So I guess doctors are definitely the most, you know, I guess they're well placed to talk about it. They are the most qualified to talk about it. But the sad truth is that, you know, we believe for some reason our movie stars are religious leaders more. So I guess in times like this, we just have to tap in the right people, the right medium, and spread, you know, the right kind of advice through those people. Doctors, of course, have to talk about it. They have to be in the picture. But I think,
just wondering, how often do you have an argument with your parent that you should do this, you should not do this, and then possibly imposing themselves upon you? Yeah.
Yes. Yeah, that's so true. That's so true. But yeah, I guess, and then of course, you know, stories and anecdotes, I think that those help a lot.
Grandparents win the argument.
I'm sorry, what was that?
No, I said, do you win the argument, or your parents or your grandparents win the argument?
Well, I guess it depends from day to day, but I think as I am, I guess, gaining more experience in how to deal with them, I think I'm being more successful now. But yeah, like I was saying, you know, stories and anecdotes help a lot. So like definitely reason is one thing, but then like just giving reasons is not enough. So like if you are asking somebody to do something, you know, just like why you need to do that, just besides giving like logical reasons, also tell them, like some real experiences that happened with people. Uh, so if, for example, areas that did not get vaccinated, like maybe some examples from those areas, people getting sick more or something like that. That definitely helps, I think.
Thank you, Nagesh. And I think this is time for possibly to sort of bring in the fact that, well, whether is there a real possibility of the kind of civilization, the kind of atmosphere, temperature, urbanization, cities, urban lifestyle that we are living in? Is there some disconnect between this lifestyle and our immunity? Dr. Aastha, what do you think?
Sorry, Dr. Tilak, I think your voice was breaking a lot, so I just couldn't get you. But I think what you want to ask is that if the climatic conditions related to, I'm sorry,
not just climate conditions, urbanization, the urban lifestyle overall, and human immunity, is it going in the reverse direction?
Well, I think, Dr. Tilak, I don't think there's any relation between urbanization and the immunity which goes hand in hand. I really don't think there's any relation between them, but I think people have to be very well educated, not also educated. I think people should have this kind of an information. They should know what to do. And unfortunately, I've seen people who have been more educated doing very bizarre and very very strange kind of things. And people, I've also seen the same with the people who are less educated. I've also seen people who are not very well educated. They have been taking very good decisions. They have been trusting doctors, if we talk about the medical fraternity. And I think I really don't think so that it goes hand in hand. I think urbanization is, sorry?
Yeah, go ahead.
Yeah, I think urbanization is something which is like a lifestyle, which is a part of a lifestyle. You grow with time, and you adapt new things with time. That is fine. But there are a set of things which should always be done. I think one of them, I think what Nagesh said and Dr. Akanksha also said, is that you really you don't have to put down somebody always. Like in India, people ask you, and let me tell you, people of all sorts ask these things, that why do you want to perform this examination, why do you want to perform this surgery, what would happen, because they have already pre-decided in their mind that I am going to the hospital and I would be wanting this treatment, probably based on what they have read on WhatsApp, what they have read on social media, which has no documentation. And here, if I compare it to UK, even herbal medications, can you believe, even herbal medications are registered in UK.
Hmm.
There is a stamp on every herbal medication.
But isn't that because of the corporates have made us believe that, well, unless you don't register and get it branded by FDA and these agencies, well, the market shouldn't trust it.
I think, moreover, not about the market, but I think it is to believe that it is safe for you. It has been, there have been studies over it, and it is safe to use. I think that is the most important part. People taking medications on their own, people, not only the allopathic medications, Ayurvedic medications, every herbal medications, every type of medication. We don't say that it is not good. They are good, they are natural, but they do have side effects, and people need to understand that. So we have been, sorry?
I think we are a bit short on time, so I'll just move ahead.
Right.
For time. I think this, I like Dr. Mohit maybe to comment a bit on it, this fact that, well, urbanization, yes, in principle, it seems to be that, well, it's just a change of lifestyle, as Aastha suggested, but it also comes with increased pollution, increased noise level, often increased stress. These things indirectly seem to be contributing to all sorts of health issues. So directly or indirectly, how would you put it?
Yes, so I would differ with what Dr. Aastha has said. I think so that as we are getting involved further in science and having a different, you can call it as an urbanized type of lifestyle, I think so. The medical science has already proved that there are so many things which are related directly to the lifestyle that we have now. And when we say lifestyle, it is not only just the lifestyle, like anything that we are eating now, we know, we are more into eating processed foods, the frozen foods, the canned foods, everything, which are being preserved with chemicals and everything, and which has its own implication when it comes to body and its health. And the topic that we discussed, before, uh, that why people from the older generations were more kind of fit in their core body strength. The reason is this only, that they were eating natural resources more, and hence they had a better outcome in their own health. And now when we are talking about, like, for example, if you see a lot of Western countries, with due respect to everyone, but we here, they are more dependent on frozen things, they are more dependent on processed foods, and we see the literature, we see the data which clearly shows. Let's talk about the bowel cancers, and I think so Bryana would agree with me in this, that that is the reason why we see the incidence is so high in the Western, or you can call as the urbanized or the developed country, as compared to the developing countries, where still people are more habitual of eating the raw kind of food, which is more fresh, which is more chemical free. So yes, we are basically paying the price of having a, you can call as like so-called urbanized lifestyle or a developed lifestyle. Yes, we are.
Miguel, what do you think? You have seen all across the world.
Sorry, I
Yeah,
have.
please. Yeah, you have seen all over the world how people are changing and lifestyle is changing. You have your mother who is almost 90.
Well, the thing is, the way people eat has been changing through the ages, and yeah, we are eating more, a wider variety of things, but at the price of having a lot of chemicals being used to grow those things, and at the great price of transporting those things, which contributes to global warming, etc., etc. So, yeah, I think in a way we are seeing already a lot of changes in the way people live, in the way people develop, and in the effects of that things that we eat have in our bodies, in our lives. But at the end of the day, I think the easiest things are the harder things to implement, such as having producers link directly with consumers, avoiding supermarkets that freeze and process foods, and uh, people having to sell a cheaper price to supermarkets because they buy by bulk, etc. So the production chain, it's has no soul, is merciless. However, I would like to point this out, uh, and I think Bryana can tell us more about it. This pandemic has told us that we are focusing on something very specific, at the risk of forgetting other people who need other kind of attention, such as cancer patients, such as other patients who have diseases that need to be looked after, and they are being uh, pushed back, so we can look, after the urgent. But we mustn't forget that there are important things as well in life.
Well, I think, Brian, I would also like your opinion on, as a young person living in one of the world's most cosmopolitan urban city, dealing with cancer patients, one of the most deadliest disease. How do you see is our lifestyle itself sustainable, and do we need to change? If yes, how dramatically, how much do we need to change?
Oh, that's a good question. Yeah, I mean, I think there are a lot of things we can do in the cities, and I think actually Hong Kong is a good example of dealing with COVID, for instance. They're, much denser population than Seattle and many cities in the US. And, they learned from the SARS outbreak in 2003 that, wearing masks was important, sanitization was important, and they haven't had the impact from COVID-19 that a lot of these big cities have seen because, they masked up, they took it very seriously. It's become part of their culture in Hong Kong to, address these things very quickly and think about more of, the community versus the individual.
Thank you, Bryana. I think there is one last key question. We are out of time, but I believe that this is an important question where I would like your opinion. Akanksha, I think you should give your opinion about the fact that how important is the relationship between doctor and patient? What kind of collaborative setup do we need, especially at the level of a small towns and villages? Because I think in the metros and big cities, it's very difficult to because people are coming from all over the world, all across different parts of the country. It may be very difficult, but especially in a small town. And I think I want on this question opinion of all of us, maybe everyone on this panel. Akanksha.
Actually, we have to be patient, and we have to collaborate with the patient's attendant also, not only with the patient, with the attendant also, because when we are dealing with the patient, we are also dealing with their families, with the societies in the small town. If we are doing something good, all the society will appreciate you. And if we are doing something wrong, they all will appreciate you. And there is the main thing, when we are doing something good with the patient, the community will always appreciate you and will support you in every condition. Like COVID patient, we are treating the post-COVID patient. Why I am putting these things about the post-COVID, after 10 or 14 days of the treatment of the patient, we are doing in DCHC or in or DCH or in any hospital, any government hospital. When we are treating the patient, we are also treating their attendant. We are counseling.
So I think
them.
that's what you are saying. This is a very key need. I think this is the same question that I asked to Aastha and Mohit as well. How much do you think it is important to collaborate, coordinate, and especially is it more important? Far more important than possibly an experimental mechanism that we are having.
Yeah, definitely. I think it's really important to have a doctor and patient trust because it is the kind of a base of the whole medical fraternity. We serve people, and we serve. If the people don't trust us, then I think it all goes null and void. So yeah, I think it's really important for us to even execute things. And I think Akanksha said it very rightly. We do not just treat the patients; we treat their attendants, their relatives as well. But I think it has to be both sides. They have to really trust us, and I would not say that they should trust us blindly. I think we should be the one who should provide them a correct information of what we are planning, and I think they should trust us on that rather than coming up with their own ideas. I think that is more important.
Mohit, just doctor or patient, or also possibly healthy people should join this collaborative approach?
I think so. It involves everyone, right from the fact, because the reason why people don't trust doctors is because we have political leaders and we have actors and actresses doing certain kind of advertisement, which make people believe that probably the medical fraternity is just doing something for the sake of anything else other than the good intentions. So I think so it has to be a collaborative effort, and it is not only the patient doctor. I think so as a society, not even in India, the worldwide, it should be like that, that we should respect the fraternity for what they're doing. And at this point of time, it is very easy for anyone to come and criticize and say whatever. But when it was the time when it was actually required, giving respect to all the other professions, everyone was doing work from home. But it was the medical fraternity who was actually serving people at cost of their lives. And when I say so, it is just because during that time, I have seen it from very, very close quarters. And I know how scared and it gets when it comes to you as a person, especially when you know that, if there is anything that happens or goes wrong, probably you'll not be able to travel with the conditions that were at this point of time and other reasons. So I think so it has to come as and you had said some time ago that whether it is demanded or commanded, I think so it is the fact that people should just respect for what we are doing. It is nothing to do. We don't want any extra respect. We just want the basic, thing that people should respect us for what we do.
Thank you, Dr. Thank you, Dr. Mohit. Bryana, how deeper collaboration, how wider partnership is needed to sort of look for more fundamental solutions, which everybody can possibly, or at least the majority can trust?
If I can say something, it's
yes.
that you must remember this. Sure. Part of the Hippocratic oath that every doctor in every part of the world does is do no harm. Do no harm. And the same way the media has a sort of social contract that says, I will satisfy your need to know, but only if you give me your will to believe that I'm giving you information based on facts. I think the doctors have the sort of the same contract. I will do you good. I will look for you, but you have to trust that I will do no harm.
Bryana, any last comment?
Sorry, I had trouble hearing your question earlier.
Yeah, I think the earlier question was, I think you're free to make any last comment, but my query was, how wider and deeper collaborative approach do we need to sort of look for more fundamental solutions so that there is an overwhelming trust towards the medical system that we adopt, and we adopt together so that everybody trusts, possibly?
Well, I think it's very complicated. Our politicians definitely have a big impact on what people believe and can be very divisive. And I think, they steer the culture and the way we look at providers and everything. But yeah, it's a really hard question. I don't fully understand why, some people don't believe in science, believe in, vaccines. I think there needs to be, more public health education around this, and, a partnership between medicine and our politicians.
Thank you, Bryana. Nagesh, your last comment on you come from the heart of corporate world. You are a tech grad, one of the world's finest institutes. I think technology will have a very, very crucial role in furthering such a collaborative approach. Wait. Nagesh, can you hear me?
I heard some of it. So correct me if I am wrong, but you're asking what role can technology play in building that trust between?
No, I said you come from we are come from one of the world's best technology institutes. You work, you're at the heart of corporate world. These two factors will have a very crucial role in shaping the kind of approach that we will adopt. How do you see that? Will they be pulling in their effort, or will they continue to work for Silicon Valley kind of values?
Well, I guess to some extent I did see, that happen even, in my experience, at least over the last year or so. So IIT Kanpur, the college where I come from, so they were involved in some innovation, building some setups, masks, PPE kits, like self-designed PPE kits, that are like really cheap at a time when there was shortage of them. And then even on the corporate side, I have definitely seen, I guess donation drives, and then corporates also chipping in, any way they can help. So for example, in the student loan industry, I know it's more of a regulatory thing, but then there were moratoriums in place, so yeah, definitely, like technology, corporate both have a role to play. It was played to an extent, but I think there is definitely much more that can be done in the future for sure.
And let's hope for the best. Miguel, any last comment apart from do not harm and humanity can save humanity?
Well, I think it's now clear that the media in any of the platforms has a very high responsibility in dealing with information that can help people to overcome these and other diseases. But it needs to act from a point of utmost respect for the people who listen to them. As long as we are responsible of spreading misinformation, we are going to be, sort of accomplices in something that is not exactly right. And we need to be very careful. We need to thank the scientific community for the job they've been doing, and the health community for the risks they've been taking. And it's all of us together who can defeat this. There will be some more diseases, some more pandemics, but if we can defeat this, we can defeat anything. Oh my gosh, everything went mute.
Thank you so much. So on this, yeah, I believe there was some interruption. So thank you so much on this positive note. We'll call it a day. Thank you, doctors. Thank you, Tech Solutions. Thank you, everyone who has worked day in, day out and are continuing to do so for making the world a healthier place. On the last, I would like to just say that, well, let's just try to make the world a healthier place and illnesses will go away. So this should not be the end of I think the journey that we have started. I would sort of request you all to sort of keep in touch and not end with this deliberation, but this should just be the beginning of a wider set of sort of working together, collaborative approach from Bihar to possibly America, maybe. And let's go for the best. Thank you so much. Thank you, everyone.
Thank you.
Thank you. Thank you, everyone.
Yeah.
Bye.